Okay, my name is Kaylee Dyring and I am doing the intramuscular injection pass-off. So before going into the patient's room, I would gather all my supplies. And I have all of my supplies right here. I have the medication, and just going over what you do with the medication, make sure that the drug cabinet is locked after obtaining the medication, but I have it all right here. And then I would go to the MAR and do my first check, which is seeing what medication to get and where to give it. And it's an intramuscular, and we're giving Toradol or ketorolac. And then I would look and see if there's any allergies that this patient has. Next, I would go into the room. Hi, Jonah, how are you? Good. Well, my name is Kaylee. I'm gonna be your nurse, and today I'm gonna give you a shot, an intramuscular shot right here at your deltoid of your pain medication. Is that okay? Yeah? Is it okay if it's with this arm too? Yeah? Okay, awesome. So then I would go back to here to the MAR. I also look for any nursing considerations. Also, Jonah, the side effects for Toradol is dizziness, nausea, vomiting. So if you have any symptoms and you're just not feeling well, maybe a headache, please let me know. So I would first do some hand hygiene, close the curtain to make sure. I also, Jonah, can you give me your birth date and your full name? Jonah Dinnerman, okay. Perfect. Birthday matches up well with my system here. So my second check, I would go over the patient, which is the right patient, the right dosage, which is 15 milligrams, and here is 30 milligrams. So we're gonna be doing half of a milliliter. And then just checking the expiration date on this too, which it looks like it's good. And then I'm gonna go over the right route, which is intramuscular, the right time right now, the right reason, which is for your pain, right? Okay. And I would only do one patient at a time while giving each medication. So I did my second check with the 6 rights. Patient, time, dosage, drug, Toradol, I said that, and then reason and route. Okay, so next I'm going to get some gloves on. Good thing my hands are dry after hand hygiene. Okay, perfect. So I'm first just actually gonna wipe down the top of the medication vial right here in a circular motion. I'm gonna let that dry. Throw that away. Get everything else prepared. Man, it's harder with these gloves. There we go. There we go. Get the needle ready. This is dried about now, so I'm going to insert this needle into the vial, and first of all, I'm going to pull it out half of a milliliter, poke the vial again, push it, and then get half of a milliliter out. There we go. Okay, and then I'm going to do the scoop method with my needle. And if I were to touch the needle on the, if I contaminated it or if I bent it, I would have to redo and get a whole new thing. Also, see you can get all the bubbles It looks good there. Okay, so next I'm gonna come over here. And before giving the medication, I'm just gonna do that. Jonah, like I said, we're gonna be giving you that shot right here in your deltoid, okay? I'm just gonna try and scan your patient's barcode. Perfect. Jonah Dinnerman, that's perfect. Right medication, so that's our third check. And then I'm going to, the gloves right here, I'm gonna get some more gloves as I administer this, making sure that the patient is at a good position right now. He is at a pretty good position to get this medication. I am just gonna pull this down. And then I am also gonna grab everything I need. So what I'm going to do is I'm gonna, Jonah, I'm just gonna touch your arm right here and get you situated with this shot. So first of all, I'm gonna put 2 fingers right here, right on the bone, right below, and I'm gonna make sure I know where I'm going to insert this medication. And then I'm going to just go in a circular motion with this alcohol wipe. Okay, I'm gonna let that dry. And then after I'm gonna let it dry, I'm gonna do the Z-Track. So I'm gonna pull this aside, take off the cap, and insert the medication at a 90-degree angle. I'm gonna hold the medication like this and insert the medication very slowly. It's about 10 milligrams, or 10 seconds per milligram. Okay, and then I'm going to pull out the needle and my hand. I'm gonna put the safety thing on the needle, and then I'm gonna throw this away in the sharps container. And then I'm gonna just put this right here. Okay. How did that feel? I'm gonna put this on, this gauze for a second. Are you doing okay, Jonah? Okay, perfect, perfect. Okay, so then I'm gonna take this off, throw all this stuff away. Take off my gloves and hygiene. Okay. And then since the medication is administered, I did my 3 checks, my 6 rights. I'm gonna put this back. Right dose, right route, right time, and then administered. So everything looks good that way. I'm gonna document anything else. And then Jonah, I'm gonna be coming back into your room in about 2 to 4 hours just to make sure there's no redness on your injection site. And also, just to see how you're feeling, if you have any other symptoms with that. But then I would go out of the room.